Welcome to the Thrive Learning Center. Patients always want to know what is the best thing to do for at-home care after an adjustment. Should they use ice or heat or something else? Timing is crucial for heat and ice because your body uses them differently. Some things to remember about heat is that you should never use an electric heat source like a heating pad. If you have to plug it in to get heat, then don't use it. Always use a moist heat source. Moist heat penetrates much deeper and causes vasodilation deep in the tissues, which will in turn reduce swelling when used correctly. Electric heat sources are more superficial and are more apt to cause surface swelling, which is harder to get rid of. Some good examples of moist heat are a moist towel in the microwave, a hot shower, or a hot water bottle. Be sure not to burn yourself. The best reason to use moist heat is to reduce stiffness and to cause vasodilation deep down to get the blood to move through the area and to take down the swelling. Heat is used for 5 to 10 minutes at a time. If used for more than 10 minutes, it may have the opposite effect and cause more swelling. The best reason to use ice is to reduce pain and to keep swelling from occurring right after an injury has happened. If swelling is already present, then putting ice on the area will only cause vasoconstriction to trap the swelling even longer. It's normal to have stiffness the morning after you get adjusted. The reason for that is because the swelling that was present around the joint has reduced itself, but some of the factors that make up that swelling that were trapped in the joint have formed adhesions in the joint, and that feels like stiffness to us. Get into a nice hot shower and allow the hot water to bathe the area for 5 to 10 minutes, and you will be surprised at how well that feels afterwards. Topical analgesics are ointments or creams that are rubbed on the skin to reduce pain. They will not reduce swelling, but they will sometimes help to take your mind off of the pain. They work by stimulating the skin to send messages to the brain other than the pain, such as cold or hot, depending on the chemical. Chiropractors in the state of Wisconsin are not allowed to give any advice about oral analgesics, so use your best judgment if you decide to follow that route. Hopefully this information will be helpful to get you a little more comfortable after you have been adjusted and help you to make good at-home care decisions. Are you ready to thrive instead of just survive? Let's get started.